I'm Dr. Howard Zucker, the doc in Docology. Robert F. Kennedy Jr. has been reinventing the Department of Health and Human Services since becoming secretary. He has slashed 10,000 jobs at the department, radically shrunk the number of regional offices, canceled billions of dollars in pandemic preparedness and research funding, and appointed an anti-vaxxer to serve on a committee looking for a link between vaccines and autism, even though the research has proven clearly that they do not. He has done all of this in the name of making America healthy again. But will it? One of his former employees at the Centers for Disease Control and Prevention says emphatically no, as he shared in an op-ed in the Washington Post a few weeks ago. And he is our guest this morning as we explore our topic of investigation. Can we trust the CDC to protect our health? 2 weeks ago, Kevin Griffis resigned his position as head of communications for the CDC, the HHS division charged with monitoring and preventing public health crises, both at home and abroad. We served there together when I was the deputy director for global health, and I am pleased to welcome him today to Docology. Kevin, thank you for joining me. It is great to see you, and you look great. You wrote a very telling op-ed, and by doing so, you resigned from CDC in a very public way. So I thought I'd start by asking, why resign, and what bothered you enough to leave a critically important job with measles and bird flu literally in the air right now?
Yeah, thank you, Howard. I mean, it was a decision that I really wrestled with for quite a while, actually. The journey to actually come to CDC, I was in the private sector during the height of the pandemic, and had gotten reached out to, and there was indication that there was an opening at CDC, and they were looking for someone. They hadn't actually had a permanent communications director for 2 years at that point. So this is the late summer of 2021, and came to CDC, worked on a lot of the issues to try to improve communications. After the pandemic, listened to a lot of people, a lot of the criticism that the agency had received for some of the work that had happened there, and try to make some changes, adjustments to that. And so had really invested a lot of time and effort into trying to improve communications there, and was really obviously dedicated to that goal. But what became clear really at the outset of the current administration was that we weren't going to be able to do our jobs the way that we had previously done them. And what I mean by that is that the folks who are in the field who are working on various issues, whether it be measles or avian flu or Ebola outside of our borders, typically when there were things that would happen that they felt like they needed the public to know about, there would be a process, as you know, for making sure that we then get that word out. But that sort of ground to a halt. There was a communications pause. That pause lasted for weeks. And it was just clear that the sort of scientist-driven, expert-driven focus on communications was not going to be the case anymore. And there was going to be more of a top-down approach. Then the second part of that, and really I think that what for me was a sort of straw that broke the back here was the Secretary Kennedy's interview with Sean Hannity. And it was right, which I think was symptomatic of a broader problem there, where he talked on that and in that interview about a number of things that were just categorically false. Whether it was the efficacy of the MMR vaccine, saying that for people who are older, they're essentially unvaccinated because of what he considered the waning of the vaccine, saying that wild birds are immune from avian flu, which is not true. They have died by the scores. Those things, taken together, and then my position as the head of communications for CDC, in the situation I was in, I was supposed to sit on my hands while the person who was considered the top health official in the country is saying things that are just wrong. I mean, misleading the public. And I just felt like I couldn't do that anymore. It was not tenable for me to stay in the role.
I mean, that's a tough situation to be in. And I'm sure not just you, but all the scientists there. I mean, I'm a tad biased, but CDC is where we all turn for science and public health. And there are scientists there who've been working their entire life on one issue. So what you're saying now is if that happens, and it's sort of information coming from the secretary's office, how do we find the correct information when these federal reforms happen? Where does everyone turn for the right information regarding public health?
That's an open question. That's one of the things I talked about in the op-ed, and one of the reasons I think that we do need to have alternatives. The folks at CDC, and I'm sure this is probably true of the other federal agencies, the scientists and experts, they really have resisted efforts to inject inaccurate information or remedies or different therapies that are not backed by evidence into their communication. It has leaked a little bit into some of the things that have I think gone out from the actual communications department, but in terms of the folks who are experts, that they have resisted that so far. But I don't know how long that will continue. So that's why I think it really is important that we look at and try to think about standing up additional organizations or to expand work that's already happening, so that people have somewhere else that they can turn, knowing that the person who's in charge of HHS has trouble with the truth.
Well, it seems to me like what's happening here. So there's an administrative change, and that's one part. And then there's these scientific changes. So when you mentioned the staff pushing back, but how long that will go on? Because my worry is that someone in one of these jobs may fear for their job, and because they need a job, right, and the safety of their job. So will they, with this reorganization, will they end up caving to some of the pressures that are put upon them in order to secure their position that they have?
I would like to think that, knowing the folks as I do, and the people that are in those positions, that the answer is no, that they would not, that they would rather leave CDC than actually keep going. But I think what we're seeing there is they're already being asked to do things that they know are without merit. So, typically when there's an outbreak like this, which the secretary, other people at HHS, they're going to be on the phone with, they're going to be having regular communication with, meetings on a weekly or even more often basis to learn about what's happening, what our folks are hearing, also what they feel like is the best path forward to try to curb an outbreak or deal with some type of situation. And that's not happening right now at HHS. Instead, while I was there, our experts did not directly communicate with RFK Jr. on one item. So avian flu or measles, he hadn't had a direct conversation, but he did talk to other people in the field, people who were in this sort of, I think, on the fringes really of the medical world, about things that they were doing.
Right. I want to get to that point about the fringe, but I'm just going back to, I remember when I was there, and you were there, when we had the issue in Equatorial Guinea with Marburg virus.
Hmm.
We had Mpox issues. I mean, we had many, I was doing the global health stuff, but we had many issues that surfaced, and there were phone calls from the secretary's office, from the White House, from elsewhere, and State Department, about what we should be doing to tackle these concerns overseas before they end up in the United States. You mentioned the fringe issue, which is a really good point, because you said there are fringe voices who are they're questioning some of these proven facts, and I was trying to think about this, about fringe voices versus conventional wisdom, right? Fringe voices are the ones who say the Earth is flat, right? Versus science that's proven it. But then there's sometimes those who question conventional wisdom. So I was wondering if you maybe could go into a little bit more about these fringe voices that you're talking about.
Well, I mean, one of them, is somebody who's been reprimanded by the state of Texas, and I think folks have written about this. There are multiple doctors who've been involved in treating patients or encouraging therapies that aren't backed by evidence, antibiotics for measles, different steroids that are being suggested. These are folks that have been acknowledged, have had direct communication with HHS. So, I do think it is important, and it's something that we try to learn from, actually, from the pandemic, is to ensure that you're sort of enlarging your circle of communication, so that you're trying to get the best information you can when there is a situation happening on the ground. I think with Mpox, for instance, we were getting one set of information from state and local health officials, sometimes hospitals and health systems, but we were hearing different things from activists and people who were in the communities that were impacted by the Mpox outbreak. So we took the time there to set up a formal mechanism to have those conversations on an ongoing basis, so that we could feel like we had more of a 360 view, and we could make adjustments based on that. We did the same thing for avian flu, where we reached out to people who were in the animal health community and other experts outside of the federal government, just to try to get a better understanding of what they were seeing, what they were hearing, and provide an opportunity for them to ask questions and have a real, back and forth. Um, those back and forths were sometimes very contentious, but it was important for us to do that to widen our circle. And I think the circle that is happening right now within HHS, specifically for Secretary Kennedy, is essentially a closed circle.
Right. So the public health experts will probably work with the states and figure out how they can navigate to make sure the public's health is protected, even if there are those who are trying to push back. I mean, you mentioned also in your op-ed that there was infectious disease experts spending hours searching medical literature to support the secretary's preferred treatments. Is that goes back to the measles issue that you were talking about before, or is that something
Yeah,
else?
that's exactly right. It's back to the measles issue. So folks would be hearing things. I assume that the secretary was hearing things. Other people within HHS were hearing things from these people on the ground, and then they were asking our experts to go and run down, this antibiotic or this steroid and try to find data to back up, some type of evidence to back up the treatment for measles, which we couldn't find.
Well, that will surely make the morale in the organization go down because people will get very disenchanted. So I thought maybe you could talk a little bit about that, about the overall morale and what has happened, when you were there during the new administration, and also maybe compare it to what happened with the morale when there were other challenges, particularly during the pandemic.
Yeah, I mean, when I came into the organization, I feel like there obviously folks were tired. They had been essentially sprinting for, 2 years, working on the pandemic, and so I think people were I wouldn't say they were at a low point because they definitely felt like they were working on something that was really important, and they were making a difference in a lot of cases, a positive difference. But it was tough. It was really tough, and then there were people who were ground down by that. So we really have spent the last couple of years trying to work to help build back the organization and try to improve people's morale. I think if you know, we can track this. The agency, as
Yeah.
surveys people on an annual basis, and they're trying to figure out, what's working and what isn't working. And you can see how morale actually improved after the height of the pandemic and how it's continued to improve up to the end of the previous administration. I mean, I don't know where it is right now, from yeah, I can't, it's hard to surmise that from the entirety of the enterprise, but I mean, folks who I'm talking to, and I do think this is like broadly applicable, are very very concerned, and feel like they don't know what's going on, and they don't understand what the broader plan is here, and they feel like a lot of people have been targeted and let go sort of villainized, for reasons that they simply don't understand.
Right. Well, that's tough. And talking about those being let go, it seems like if you're going to drop 2,400 people out of the department, that's going to really hit at the core of what they do and who they are. And I thought maybe we could walk through some of the areas that have been hit, because I was looking at this, and then maybe you could share a little bit about what they do. I saw that tobacco control was one of those areas that was tackled, and maybe you could share a little bit with everyone about what they do, because it's a critically important part of the agency.
Yeah, I mean, one of the things to do that's really important, I think, is they're monitoring trends in tobacco use. That doesn't happen elsewhere in the government. So, a few years ago when we saw the rise of vaping, specifically Juul, our folks were really on the front lines of that, and they did a research paper that they published. They could call sort of notes from the field. So it was more of a real time paper that gets published to help people know that this was happening, and so that helped to actually change the trajectory of how we were thinking about discouraging tobacco use, and moving away from the focus on simply on cigarettes to then looking at vaping and things like that. So that's not happening right now. That program was eliminated, but also there's a program within there that is where the statutorily required for the cigarette companies to report their ingredients that they use in their products every year. The people who actually process all that information, take it in, and keep it there at CDC, those folks were let go as well. So there's still a statutory requirement for the tobacco companies to report that information into CDC, but there's no one there to take it, or no one knows what's going to happen with that information.
That's concerning, and I mean, I guess that'll be challenged at some point, maybe even legally, if they have a statutory requirement. And that tobacco center has been, or tobacco control issue has been around for a quarter of a century, looking at this issue. So that's a critical area. What about the injury center? They're also been around for about 30 years or so.
Yeah, I mean, I think there's a number of things there that we're concerned about in terms of violence prevention and other issues that Injury is working on. Even simple things like grants that go toward and work that goes toward helping the community centers to help kids learn how to swim, things like that, because knowing that drowning is a leading cause of death for younger people. So that's another area. And then I think we see like broadly across the entirety of the organization, communications has been badly damaged. The team that I worked on, all of the media relations folks, the kind of frontline people that actually answer the media inbox, the people who are in our television studio. So if there's an outbreak, they actually man a studio and work the cameras and everything. The people who did social media, all those folks are gone. Those jobs were eliminated yesterday, and the cuts were deep at CDC. They were deeper at FDA on the communication side. So that's really going to impact our capabilities moving forward. And so, as a country, we're going to have to sort of be crossing our fingers that something significant doesn't happen, because we're going to have a difficult time communicating about it right now.
Right, and that's the big worry we mentioned before: bird flu, measles. But there's always something that could pop up that we aren't even aware of. Another area was HIV prevention, and this one really surprises me, because there was this whole issue that they were saying they wanted CDC to look at infectious diseases as well. What infectious diseases cause more problems or more challenges, I should say, not really, more challenges for everyone than HIV/AIDS, and what we've done and what we've achieved in the ability to control that and to prevent it is really a testament to HHS and whether CDC, NIH, FDA, everywhere for that matter, and also on the global front. So I don't understand why that would be taken away.
Yeah, I don't think I think you have the same questions that people inside the organization have, and I don't think people inside the organization have been provided answers to that either. I mean, there was an interview that the secretary gave recently with Chris Cuomo, where he talked about people from Doge, what he called characterized as geniuses, who were the ones behind the plan. But it's very difficult to discern what the plan actually is. I mean, to give you one good example of this, the people who are within the Office of Human Relations who are charged with actually the people who are actually planning around the rifts, the reductions in force, they are I'm sorry, Office of Human Resources, they were actually rift themselves. So the people who were put in charge of actually processing all of the folks who were being fired, they were fired. So now there's all of this is sort of up in the air, and they're trying to figure out from a process perspective what to do.
Right. So just so for those who don't know, RIF is the reduction in force for that, that acronym. Sometimes they pop up. CDC has a lot of acronyms, obviously, but that's a big, we love our, yeah, I know, love our acronyms. Another area was tuberculosis containment, another infectious disease that seems to be being cut. And yet, when you look on the global front, this is a big concern, particularly drug-resistant tuberculosis. So I'm not sure why that one has been pulled away, and where is it going, or anywhere?
Right. Yeah. I mean, there's so many different programs. Oral health. I mean, CDC is really the home to the only program that gives money to the states. There's like 15 different states that receive money from CDC focusing on oral health. Right. And as you know, for some people, especially potentially lower income patients, their interaction with their dentist may be the longest interaction they have with the healthcare provider during the course of a year. And sometimes that dentist helps to connect them with other healthcare providers. So it's a really important function, and oftentimes one that we see,
Right.
most valuable in rural areas or lower income areas.
And it ties back to cardiac disease, oral health. So it ties back to a lot. And the last one I just wanted to bring up was the whole Center for Forecasting and Analytics. And the reason I mention this because I know I had a phenomenally talented person running that whole team. And it was looking at analytics. It was looking at modeling. And I remember that this was sort of part of the changes that CDC was making as a result of sort of the pandemic. So I wondered why that would be moved away when it's such a valuable asset for public health.
Yeah, I mean, this is the thing, that there was no discussion about that internally. It's not as if there's meetings that are happening where they're laying out this sort of broader framework and a philosophy behind everything that's happening and really laying it out for employees so that they get it or anybody else. So your guess is as good as mine as why they chose these specific things. Um, Nobody knows. I mean, and the individual who's in charge of that team, like a number of other senior leaders at CDC yesterday, received a note saying, here are like 4 or 5 different Indian Health Service uh, facilities you can go to around the country. You can either do this or be fired.
And they mentioned that they had to get back to them within a day or two, right? Pretty quickly.
I think they have to get back to them by 5 o'clock today.
Oh, unbelievable. Unbelievable. Let's ask them to change their life so quickly. And also, obviously, the whole world of global health, which is dear to me, because I know that CDC has a lot of people at the World Health Organization, and those people are a talented crowd that are going to have to come back. And we value the experts out there in global health because they are our eyes and ears for what's out there that may end up on America's shores. So I suspect that may be a part of the challenges that we're going to face as well.
Yeah. I mean, they've already run into it in Uganda, in Tanzania, where, typically they would be talking with and having meetings with counterparts at WHO, and they weren't able to do that. They are able to communicate on a one-on-one basis with counterparts at WHO in these specific outbreak situations,
Right.
but otherwise they're not.
And they do have outbreaks going on there, as we know. Back to the communication part for a minute. The HHS Deputy Press Secretary mentioned that they wanted to centralize communication. They felt that there were too many communication teams across the entire department of HHS. Mm-hmm. But I was wondering what you think about what they said. They said that they wanted to decrease this as a way to more effectively have public health messaging. What do you think she means by that?
Yeah, I mean, I think that what the design is that they want more control over it, and so I think which that means is probably less control by people who are the experts and the scientists driving communication, as opposed to people in political positions trying to dictate what that looks like. And I don't think, I think that the hallmark of the disease response is trying to utilize every lever you have at your disposal, and decreasing the amount of capability you have is basically taking us back to a period well before the pandemic, where we're going backwards, we're diminishing capabilities instead of trying to build them up. So that's I think a significant move in the wrong direction for public health.
Well, you know what I thought for a minute? Just looking at it from their perspective for a moment, I thought, let's put science aside, all the challenges that have been put upon the staff, which are enormous, aside. What do you think about the overall concept of reorganizing the department? And while I give you a second to think about it, I was thinking about this from a personal experience that I had. Because when I was at HHS the first time, they created the Department of Homeland Security, because it was right after 9/11 and anthrax. And there were a lot of power struggles that went on as things moved around. But, the President Bush at the time viewed it as in the best interest of America to coordinate all these agencies. And it really had a major impact and has improved many things that we now have a Homeland Security Department. So how do you see that, and whether this whole concept that Secretary Kennedy is saying about creating an administration for a healthy America, how do you think that will play out?
Well, in the case that you're talking about, and I think generally speaking, whether it's in public sector or private sector, usually a process like that is one that's very carefully thought out over a long period of time. So I think you talk about reorganizing, let's say, an 80,000 person company, which is essentially what HHS is. That's something that's in the private sector usually going to take months upon months. Is going to involve deep dives in that business by the people who are working on that change. It's going to involve talking to the people whose jobs are being impacted, so you can really understand what they do on a daily basis, and what the downstream effects are and potential unintended consequences. I mean, you're going to bring in people who are change management experts, to help try to integrate different organizations, agencies that have never worked together before. Right. None of that occurred this time. This is a something that's been slapped together in a period of, a few weeks by people who are not experts on public health and are not experts in the work of the federal government. And my sense is that things are going to break as a result of that. And so, on topping all of that off, you have somebody leading this effort who's never led a large organization before. So there's a lot of things there that I think are make it a high likelihood that we're going to have failures here.
So when you say things are going to break, do you mean that our ability to respond to a public health emergency will not be there, or other things that will break?
Yeah, ability to respond to a public health emergency, but also like simpler things like just the basic sort of connectivity we have between the federal government and state and local health authorities. We're already seeing that breakdown. I was already seeing that breakdown before I left, where for instance, the case of the measles death in Texas, that was announced, and typically we would have coordinated very closely with the state of Texas and others on the ground. That was announced without the knowledge of the communications team within CDC, which is extremely unusual.
I mean, also MMWR, which is a journal, publication of CDC, which is extremely well respected. That I don't know, and I haven't checked recently whether that's still being published or not, but that is where a lot of information does come out regarding some of these outbreaks. So I suspect you had to deal with that as well.
Yeah, I mean, that was we worked for a long time. Books were working behind the scenes to try to, it had its first pause, I think, in like 70 years. That's a huge amount of time. And so that was something we were trying to educate the folks who are at HHS who came in about how MMWR works, try to answer questions that they had about reports that were in the pipeline. And eventually it did publish, but I think, there's definitely concerns about it moving forward. But that episode actually points to another issue with how the sort of process around the beginning of the administration. There really wasn't a transition that you would sort of normally expect, where the incoming administration would be sitting down with the folks at CDC and having these ongoing meetings for a span of months to try to really understand what's happening, understand different outbreaks, et cetera. I think there was one face-to-face meeting, and other than that, there was none. There was paper that was passed back and forth, but in terms of a normal transition period, it didn't exist.
Well, that is critically important, to get the facts of what's happening and sort of hear about it from those who are right there and been in the department for a long time. You mentioned in your op-ed that they want to bend science to fit to fit his own narrative. Do you think this administration for a healthy America, that is what's going to happen, that it's going to be focused on what the message that they want to put out there is, or do you think that that won't be the case?
That is the concern. I think it's widely known at this point that HHS directed CDC to make available to NIH data sets related to vaccines, and so that they can do another study, as you mentioned at the top of the show, about whether there's a connection between vaccines and autism. And then there's been some reporting about who specifically may be doing that work. So yeah, that's a big concern, I think, and that's the the sort of insidious thing that we're concerned about here, is that people will use their position to essentially forward their own agenda, as opposed to just following the evidence and talking about the most what actually works, and putting forward the most effective public health solutions.
So how does one keep CDC independent? I mean, in this whole era of politics, whether either side of the aisle, it doesn't really matter. How do you keep an agency that's focused on the public's safety and public health independent moving forward?
Yeah. I mean, I think that's going to be a huge challenge here, especially given how they've the changes that they're making around communications. I think it's going to be tough to do that. I mean, that is actually one of the things that we looked at after the height of the pandemic. We took part in a couple of different focus groups where we invited in people who were part of the medical freedom movement. We did some other research related to vaccines, trying to listen to people who didn't feel good about public health, really did not we did not think highly of the agency after after the pandemic, to try to understand, what things really bothered them about it. And one of the things that we heard was, that they were really upset about people at CDC appearing alongside, people who they viewed were politicians. So doing things with the White House. So I think, after this period is over, and if there is a period where there's some restoration process for CDC, I think folks who are doing communication, continue to try to build an independent of profile, so that you're doing your own news briefings, you're doing your own work, and not being entangled necessarily with the folks who are working on the political side.
I remember when I got there, all the reorganization was already happening. And so there were a lot of things being done to help address some of the questions that were raised as a result of the pandemic. And it was a once in a century pandemic. So of course, there were going to be things that needed to be adjusted as we moved forward. If we just said there wasn't all this tumult going on, what areas at the CDC, or what programs or budgets or administrative changes do you think need to still be made so that we're ready for the next pandemic or something that would happen in public health in general?
I mean, I don't know. I feel like in some ways that conversation is sort of moot, because it's just because of what's happening. It's so hard to say, to imagine a world where what's happening right now isn't happening. I think that the CDC had done a lot to try to improve its sort of preparedness footing. We made a lot of structural changes so that some of the same missteps that occurred, I think, in the beginning of the pandemic wouldn't occur again. But I mean, I think now we've moved backwards, and I think,
Right.
Whenever this is over with, we're going to be starting from a much different place.
Well, we want everyone to know there's a public health agency out there that they can turn to, because if there's another H5, or if there's a pandemic, H5N1 or anything else, we need to be sure CDC is ready for that, right? I mean, that's the critical issues here. They said today in the news that Senators Cassidy and Sanders has asked Secretary Kennedy to appear before the Senate to discuss all these changes. So perhaps, Congress is going to address some of this that's happening right now, and see whether those changes will happen, or whether they'll push back on some of those changes as well.
Yeah.
I'm curious whether there are three key takeaways from today's conversation that you think we want to be sure to get out to the public about the changes at CDC, and particularly how it affects their lives.
Well, I mean, I think, at least in terms of information that's coming out of HHS, I think you need to make sure that you're checking that information, talking with your provider, looking at your local health department, or other sources that you trust. I mean, one good thing, Howard, that I think that came out of the pandemic was that there were people who are, I think, great at translating scientific and medical information, who sort of kind of rose to prominence during that period. And they're still out there. They're doing the work. I mean, I'm thinking of people like Caitlin Genelina,
Yeah.
who does your local epidemiologist, people like that, who are empowered and are doing good work in this space. And there are others that I think are doing the same. And I think that we'll kind of see them. I think their work kind of continue to be elevated during the next 4 years. So I think, again, like, making sure you're checking that information. And I would think if people have an opportunity to, I just think trying to stay abreast of what's happening on the ground in a given situation, and going to trusted sources.
It's as you mentioned, some of the people there. I was thinking about, there's incredible talent at all levels. I was thinking about the respiratory diseases, the teams that worked on Mpox, just those who have worked on flu, not avian flu, but just flu in general, and the data that comes in every year, and how incredibly smart and talented they are. The environmental health issues, the wildfire issues as well. I remember last year when we had a couple of years ago, we had the heat crises in the country, and the climate change issues. So I think it's an amazing team. So I don't want them to get demoralized. And I think that for the best interest of all Americans, that they that they're there and they continue to be able to do the work they want to do. I know we've spoken for quite a period of time, but I wanted to now reach out to at this point to speak with our guests, our subscribers out there, because I'm sure they have questions that they'd like to ask you. And so we'll tee that up. But just a quick point: all the information that we present is obviously for informational purposes, not a medical issue. A doctor's visits should not be. You should go to your doctor if you have a medical question, and you should not just listen to use their recommendations for any medical concerns that come up. But let's turn to our subscribers, see what they're concerned about. And maybe, Kat, you could put the first Docology subscriber on for today.
Well, Dr. Z, this is where I take it away and I do the first question. So I give everybody time to type their questions. But I was just curious because we've seen in a variety of sectors sort of people coming out and saying, this I can't abide by anymore. And I was wondering what sort of advice you might give to someone who feels like they're in that sort of position where they just feel like they can't abide by what's currently happening and how they go about sort of voicing that in fear of backlash.
I mean, I don't know that they should, I don't know that everybody has their own sort of situation that they're dealing with. And I know that's something that people are evaluating all the time. They may have, it's just scenarios where they're only breadwinner in their family and they need to stay in that situation, but they are thinking about voicing their concerns. The one great thing about the technology that we live with now, it is a big democratizing force in that regard. And so there's so many different places you can share that information. I mean, obviously, as somebody who works for the press all the time, there are probably people that I have relationships with and things, so that I have maybe some access to platforms that not everybody would have, but like pretty much everybody has access to LinkedIn, and they can talk about what their experience was like and voice their concerns there. And I wouldn't really worry about the fear of the backlash to that. I mean, honestly, overall, I think the reception that I've gotten, the feedback that I've gotten has been very, very positive. People have been very supportive about speaking out, because I think a lot of people were feeling the same thing within the federal government. And so, as long as if you feel like you can't do the work anymore, and you're feeling too compromised or complicit in that, then I feel like you're going to have support, and people will reach out to you if that's something you want to do.
Well, I will say that the colleagues I've spoken to at CDC are thrilled that you came out there in that op-ed and said exactly what they're feeling. So kudos to you for doing that, because I think it's important to do that for those who are at the agency as well. And Kat, who else do we have?
Gonna bring up Miss Eileen, who has a question.
Great. Eileen, how are you?
I'm well, Howard. Thank you, Kevin, for your courage, I guess, in speaking out. It's probably strange that the first question is coming from a Canadian, not from someone in the US. But in this, as well as in other things, I feel as if the US reputation is being diminished. And I just like to mention something that's really hitting the news in Canada right now. There is a prestigious cardiothoracic surgeon in Ottawa who was just about to move to University of California at San Francisco and backed out of the deal because he said he could not stand the thought of working in the United States. And at the same time, medical recruiters in Canada are saying that the floodgates are now open and they have so many applications from US physicians who want to come up to Canada to practice medicine. So Canada may well be the beneficiary. We will find out at supper time tonight what else is going to be cut, but we may well be the beneficiary of U.S. expertise. And I'm wondering, do people in the U.S. medical community, are they feeling this? Are they feeling that their reputation, their ability to share their expertise is actually being diminished and cut, thanks to Secretary Kennedy or President Trump?
So I can start. I'll start on that, because I do know from speaking from doctors, the big worry right now is that a lot of research is the funds for research is being cut, whether it's through NIH funding or funding through the universities that have money coming from the federal government. And that is making people very uncomfortable, because those who do a lot of this research are innovative. They have a passion for the area that they're working on. And the last thing they want to find out is that what they've spent the last 4 or 5 years on, which was being funded by the government, is now suddenly shut down. And if they turn to, the Research Council in Canada or somewhere else, they may say, well, if I can get funding, I'll go up to one of the provinces up there and continue doing what my heart wants to pursue in the effort of improving people's health. And I suspect the same in public health is the case. Kevin, sorry, I don't want to cut you off.
No. I mean, I think that's right. And I think you would know, I think you would have so many connections to people who are in research fields around the country. And I don't, it's very puzzling to me to want to diminish one of the great strengths of our country, which is our research capabilities.
Yeah, thank you.
Thank you. Kat?
So we have a question in the chat that I'm just going to read because this person does not want to be on camera. But their question is, if there were a major public health emergency tomorrow, such as human-to-human avian flu transmission or a much larger measles outbreak, how will the CDC as it is now be able to respond? And what could the public do to protect itself if the government might not be there for us during a large public health emergency?
Great question. Whoever doesn't want to be on camera, but that is a great question. Kevin.
Yeah, I mean, I don't know the answer to that. I mean, I don't, and I think frankly that, so right now, let's say that one of our former colleagues, Dr. Zucker, wanted to go down into the CDC studio and wanted to do a press briefing on camera to talk about whatever outbreak it was going on, whatever public health challenge was happening. There was no one there to actually man the camera. There's no one there to be in the studio to actually put this person on air. So it's basic capabilities that we really come to rely on. They don't exist right now. So I think it's going to be slower, and I think that the likelihood of there being political interference is higher than it's ever been. And so I absolutely worry about that. And again, that's one of the reasons why I wrote the op-ed, to try to sound the alarm about what's happening at CDC, and then and to get people thinking about other alternatives that might exist, or improving capabilities that we have and building them up so that people have other places they can go for information.
I'll add that when I was health commissioner, I turned to the CDC on a regular basis for outbreaks, whether it was the e-cigarette issue, which you mentioned before, measles, when we had a measles outbreak. We had a fungal infection, one of these potential drug-resistant fungal infections in the hospitals. And every time we turned back to the CDC and said, okay, send us your expert, because there was always somebody there who was this incredible expert who spent, like I was saying, 15, 20 years studying that. And the same with the pandemic. I mean, if a person-to-person spread of avian influenza happened, the states usually were able to get assistance or advice from the experts at CDC. And I hope that that doesn't go away, but it sounds like that is one of the big problems that's potentially occurring. Kat.
Super nervous. I'm going to bring up Mr. Joe. He has a question for you guys.
Right. Joe.
Hi there. Yeah. I guess especially over the last 5 years or so, we've seen a dramatic swing in the trust in public health, starting with COVID from one administration to another. And maybe that trust has gone up or down depending on which side of the administration that you're for. But how do you view currently the state of trust in the public health system? and institutions, and what steps are necessary to build or rebuild that trust, from whether depending on especially what side of maybe it's the political aisle that you're on.
Mm-hmm. Yeah. Yeah, I mean, I think that was one of the things that we were really wrestling with, and have wrestled with over the last couple of years, thinking about, are there things that we can do, changes that we can make to how we talk about things to help, maybe break through with people who had concerns about how we were talking about things. I'll give you one sort of simple example. One of the things, that messages that we would typically lead with vaccines was saying, vaccines are safe and effective. Now, obviously, we believe that vaccines are safe and effective, but within the medical community, within the public health world, when you talk about that, what's understood is that you're saying it's safe and effective in relative terms, meaning much safer than getting sick with one of the vaccine preventable diseases, and that side effects are very rare and they tend to be extremely mild. But what we heard from folks is that they were interpreting it in absolute terms, meaning that they were always safe, always effective, and never had any issues with it. So we really changed how we were talking about vaccines to try to get over that barrier, because when people were hearing those words, they just turned off. And they weren't getting to the next part of the information. So we really started talking about vaccines as the best defense we have, or best protection we have against a given pathogen. So I think part of it is, doing a better job of listening to critics, to people who have different ideas, to try to figure out if there are ways that we can find common ground and deal with some of the hurdles that people have to listening to public health. But also, I think we're probably in an era as a country that is more skeptical of institutions, and so I think that sort of thing probably ebbs and flows, waxes and wanes over time. But I think it's the more that we can show empathy, the more that we can engage meaningfully with people who have concerns, I think that the better that will be for building back trust. And obviously, one of the key things that we were focused on was trying to make sure that when we simply executed well. So during the Mpox outbreak, during avian flu, we really were doing everything we possibly could to simply do the basic blocking and tackling of public health, and to answer the questions that people had, and to get treatment and effective help to communities that need it.
Joe, I'm going to add one other thing about the trust issue, and Kevin should chime in here, because I remember when I was at CDC, there was a report that came out about who people trusted and what agencies within the federal government people trusted. And I remember CDC being pretty high up on the list as one of the agencies that the public trusted the most. So am I remembering that correctly? Can I remember there was that?
Yeah, no, that's true. And that's been consistent, I think, over time, is that I think people have maybe a mistaken impression that the trust in CDC is, similar to what we see for other institutions, but it's actually typically in the 60s or 70s. But that is an erosion from where it was, and I think we actually went back and looked at the trust in CDC after Ebola, for instance. And you did see actually a pretty big dip there. And it was also saw largely along partisan lines, where we saw more erosion among Republicans, but it rebounded pretty quickly. I would say within a couple of years, it was sort of back to that pre-Ebola outbreak levels. But this one has been, this dip has been more durable. My concern now is that, we've seen the decline on the Republican side, and now we may see a decline on the Democratic side. And then, then we're talking about a deeper hole that public health will have to try to climb out of. I think one other thing I just wanted to briefly mention was just in a lot of the communication that Secretary Kennedy has had about HHS. He keeps talking about the lack of trust in the organization, and then also low morale within HHS. Both of these things are, as you mentioned, easily verifiable. There actually is pretty high amount of trust in CDC compared to other government institutions. And if you look at the morale of the agency over the last few years, it really rebounded, and it was actually quite high compared to other agencies.
Joe, I hope, did that answer your question? Hopefully.
Yes, it did. Thank you.
Great. Thank you. Thanks, Joe. Kat?
Look at me. I was on mute. I was even talking. I'm going to bring up our last question from the audience. Mr. John, go ahead and ask your question.
Hi, John. What can we answer?
Hi. Thank you so much for joining this, Mr. Griffis. It's fascinating. Can you take us inside a little bit? What happened when you saw RFK Jr. on that Hannity interview? I mean, you're heading up communications. Do you raise a concern to anybody, and to whom, and what was their response to that?
Yeah, I mean, I definitely talk with people who are higher up in the organization about it, and also trying to. I mean, sometimes there's some things that were said that I was wondering, well, did maybe he hears something from someone in the organization and maybe misinterpreted it, but that was not the case. I mean, for instance, in the cabinet meeting when I indicated that 2 people had actually died in the measles outbreak, everyone heard that and they were sort of mystified because we hadn't heard that at all, and so we were thinking, well, maybe he has access to information somehow, or got some briefing that we're not aware of. And so, reporters are calling us trying to figure out what's going on. The same thing happened after the Hannity interview, where they were asking about, well, where is he getting this stat from, or where is he getting that stat from? So it really starts a sort of scramble within the agency to try to figure out where the things he's saying are actually coming from, and if there is any shred of truth to them, or if there's any kind of backing, so that we can understand and try to provide some context or characterize it to reporters. There was an instance where CDC was asked to put a banner, for instance, on some web pages that there were web pages that had violated one of the executive orders that were taken down, and then they were restored because of a temporary restraining order in the case. And the folks, I guess, at HHS and presumably the White House were displeased with that, and so they put a banner up on the page, which was a very obviously political language. It was unprecedented, certainly during my time at CDC, to see language like that on our page. We really tried to be very neutral in tone and avoid anything that would be considered a political statement. And so I went to the person who was the acting director and said, this has the potential in the long term to damage our credibility. And what came back was, just comply, follow the directive, and not thinking about the long-term consequences. So I don't think, in terms of the political appointees, that there's a lot of room for disagreement right now. That may change, and perhaps when they have a permanent director, there will be more back and forth. But right now, I don't feel that.
Well, in that environment, you did a very courageous thing, and it's admirable. Can I ask you one other thing? Does it strike you that if things start to go off the rails, if it turns out they cut too deeply, or they cut in the wrong places, or they were wrong about their preconceived notions, let's say about if this guy investigates, once again, potential links between autism and vaccines, and it turns out he can't prove it, now that he's seen all the evidence, do you think they have the capacity to change their minds, change their policies, whether or not they admit ever that they were wrong? Are they just true believers out, come hell or high water, to impose their point of view, or are they open to just finding the best outcome?
Yeah, that's a great question, and I don't know the answer to that. I can give you one example but I don't know how instructive it is. So we they were very concerned about the advisory committee on immunization practices, ACIP, the CDC. So they make recommendations about the vaccines for the country, and they were very concerned about the people who are on the committee, and felt like that they are compromised or conflicted in some way that they shouldn't necessarily need to be members anymore. And so my team went back through and went through every single, as part of the ACIP meetings, you have to declare your conflicts of interest at the very beginning of the meeting. So they went back through every single meeting for over 20 years and then cataloged what every single person said. It's now available on a searchable database that you can go to at the CDC site, so you can look and see what every member of the past 20 years, what they've said as their conflicts. And then they came to that and they said, well, there's no smoking gun. There's no conflict that is disqualifying here. And they just kind of moved on. So maybe that would happen. I don't know for sure.
I guess time will tell. Sorry.
Yeah, I mean, there's the potential that if the world's leading anti-vaxxer gets his hands all over the research and comes out and says, all right, I couldn't prove a link between vaccines and autism, that could kill the whole anti-vax movement. There's that potential too, right?
Yeah, that seems unlikely to me, but perhaps.
What do you think is more likely as an outcome? How do you think that will turn out, that specific?
Yeah, I mean, my guess is they just move on, and then there isn't a sort of definitive statement. But I don't know. It's hard to say. I mean, I think they're looking at it in a few different places, and they're really trying to find it. And that's the worry here, is that instead of looking at the evidence and telling, and saying and letting people know what the evidence says, they're starting, what that conclusion indicates. They're starting with the conclusion and trying to find the evidence.
Right. That's not a good way to do science at all. Right. It's like go to your conclusion first. Well, thank you, Kevin. You have presented incredibly important information and facts and your perspectives. And again, thank you for speaking out and sharing your views as, in many ways, the voice of a lot of people at CDC and what they wanted to say. And they're glad that you spoke for them. And I hope that as we move forward, that CDC continues to be the place that people look for the critically important information that they need. So I appreciate it. I look forward to continue our conversations, not on YouTube, but in general, and we'll see where things go. That is it for our show for today. Next time on Docology, we're going to hear about the effects that policy changes have on state public health agencies and how they will affect you in the public, which ties into sort of what we've been talking about today, because it addresses some of the issues of money that's been going from CDC out to the states that need that to continue to do a public health work. But remember, if you are a Docology subscriber, you can join the show. You just have to click on the link below. So please tune in next time, because the topic we cover may just save your life.
Docology's production of Hang Media. Our producer is Catherine Warren. Ronnie Zelig is our editorial advisor. Our creative director is Anna Richard. Janine Wilson of Wilson Media Group handles paid marketing. Our publicists are Leslie Ann Wade and Jerry Caracol. And our executive producer is John Clark. Theme music was composed by Nick Chitz. Subscribe and join our community at docology.life. Until next time, exercise, wash your hands, and stay healthy.